In this video, I'm going to tell you about your days in the hospital after having had a hip or knee replacement. The spirit of your stay in the hospital is one of activity and mobility, guided by your physical therapists and occupational therapists. Your physical therapist will work with you on the day of surgery and the days after, usually twice a day. The occupational therapist, again, will work on activities of daily living. You will also be visited by your surgical team, including your surgeon and hospitalist physician, as well as nurses and physician's assistants. They will be assessing your needs, your laboratory work, and your vital signs, making sure you're progressing safely. It's important that you communicate with your team, especially the nursing staff, should you be having any problems. The goal is to mobilize you and get you active. This means advancing you to a regular diet, discontinuing intravenous fluids, and discontinuing your bladder catheter, generally on the first or second day after surgery. Your pain management is very important after surgery. Please communicate with your nurses who will be coordinating your multimodal pain management that includes narcotics, anti-inflammatories, Tylenol, and nerve modulating agents like Neurontin. Without knowledge of your pain, we can't make changes to that program, so please communicate well. You will also meet with a case manager who will help assess your needs for when you leave the hospital. This generally includes arranging home physical therapy and other pieces of durable medical equipment that you may need. Let's talk about the discharge plan. Younger patients and those who have had a total hip replacement may actually look to go home that first day after surgery. For those of whom who stay in the hospital for the second day, I will now tell you about that. With your second and subsequent days in the hospital, physical therapy and occupational therapy is again a theme. You'll be mobilized at least a couple times a day with the physical therapist. Again, we want to ensure that you have advanced to a regular diet and are not having nausea or vomiting or other issues, and that your pain is well controlled on oral medications. The case manager will continue to work with you in regards to home needs, and those who have had a total hip replacement, if they have not gone home the first day, generally go home the second day. Total knee replacement patients may stay a little longer because pain control and mobilization can be a little more difficult. So please realize that that can be an issue, and be sure to communicate with your surgical team in regards to pain control. It's really a minority of patients that go to a skilled nursing facility after surgery at this point. There are some patients, generally on multiple medications, who have poor home support and who are over the age of 75 or 80 that may need to go to a skilled nursing facility. The case manager will coordinate this with your surgical team. So thank you for listening about your experience in the hospital after surgery. Again, it's a theme of mobilization and activity and communication with your surgical team to make sure that you're safe and that your pain is well controlled. Thank you.